Trade union Hospersa is calling on the KZN Health Department to withdraw plans to loan community health workers to schools. This is part of the Education Department's school readiness plan. Now, the union says the health workers should continue assisting home-based patients in ensuring they don't default on their medication. For more on this, let's speak now to the union's Kevin Halama, who joins us via Skype from Pretoria. Mr. Halama, thank you very much for your time. Has the KZN Health MEC responded to your demand for the withdrawal yet?
At this point, Goli, the KZN Health MEC and the department, they have not responded, and we're still trying to get hold of their office so that they can retract the statement that they've made, or at least consult with Labour before loaning out these community healthcare workers to the Department of Education on Monday.
Yeah, talk to us about the critical work of these healthcare workers in the communities they are currently operating in.
What the role that the community health workers do within communities, they ensure that a number of the acute patients that are home-based and can't go to health facilities, they attend to those patients. They also ensure that a number of the patients which can't get to facilities like your clinics to access their chronic medication during this time of COVID-19, and they also make sure that those ones, they also do assist with that. And also further to that, Goli, since COVID-19 began, a number of these community healthcare workers are assisting within the Department of Health to screen suspect cases of COVID-19. So they are playing quite a critical role within the Department of Health as it is. And we feel that loaning them out to the Department of Education is going to create a void of a primary health care service that is being afforded to the affected communities.
Yeah. In your statement, you state the following, that it was always your understanding that the extended public works program and the youth brigades would be the ones assisting in the screening and sanitizing at the various schools. Why do you think that this plan has suddenly been abandoned?
That's exactly, Goli, and it's also to our surprise that the KZN Health MEC would make such pronouncements without engaging with Labour if they are having any challenges with regards to rolling out the EPWP plan or even the Youth Brigade plan. For the department to just come out and make a pronouncement that the community healthcare workers will now be assisting, for us that changes the working conditions of these community healthcare workers, and also we are worried that by loaning them out to the Department of Education, which department is going to be responsible for their safety when they are there at in those schools and screening and sanitizing these students, and how is that work going to be carried out? Are they going to be screening in the morning when the students arrive, and what are they supposed to do for the rest of the day? So these are some of the concerns, Goli, that we have at this point in time, and we feel that we do want these community health workers to play a bigger role within the rollout of our response to COVID-19, but it must be done with due consultation, and the department should come out and be clear about its challenges with rolling out the various plans that they had.
Yeah, talk to us about the number of workers you represent in this sector of workers, and add to that your message to them come Monday.
Within KZN, we represent close to 2,000 community healthcare workers, Goli. Maybe I must just put this in context. Community healthcare workers, there is a resolution that we signed at the Public Health and Sectoral Bargaining Council in 2018, which speaks to them being absorbed. In that resolution, it's clause 3.3 and clause 5.5, where we make commitments with government that we will work at absorbing these community healthcare workers so they become part of a key sector within the delivery of primary health care. So what we are saying at this moment is that until the MEC of KZN comes to the table and speaks to Labour regarding their loan agreements that they're doing to the Department of Education, our members, Hospersa community healthcare workers, will not be reporting to schools. Instead, they'll be carrying out with their current responsibilities within the Department of Health with assisting with providing primary health care service.
Kevin Halama from the union Hospersa, thank you very much for your time.